Hi, welcome to the clinic. How can I help you today? So right now, most of the guidelines call for 6 feet of social distancing whenever possible. And at most medical centers and health clinics, the doctors and the patients are required to wear one of these types of masks. This is an example of a simple mask face covering, and this is an example of an N95 mask. How will the new policies at hospitals and health clinics that require masks and face shields affect your ability to hear your doctor? Hi, welcome to the clinic. How can I help you today? Hi, welcome to the clinic. How can I help you today? Hi, welcome to the clinic. How can I help you today? Hi, welcome to the clinic. How can I help you today? Hi, welcome to the clinic. How can I help you today? So I took my smartphone and I used the sound level meter from the National Institute of Occupational Safety and Health, and I recorded the volume of my voice from 6 feet away without any mask, with a simple mask, and with an N95 mask. So clearly having a mask over your face affects the clarity of speech when you're trying to listen to your doctor. A simple mask like this is easier for the acoustic signal to pass through, but a thicker mask like the N95 masks, that's harder for sound to pass through. Whether you have normal hearing or you have some degree of hearing loss, we use facial cues to understand the message. Right now you're looking at my lips, you're looking at my face, and that can help you be sure of what sounds you're hearing are matching with what I'm saying. When I'm wearing a mask over my face and you're trying to listen to what I'm saying, your brain has to work a little harder to understand the message completely. Hey guys, my name is Dr. Ben Thompson. I'm an audiologist and tinnitus specialist in California. So of course the coronavirus is real, and each hospital and health clinic needs to take precautions about how to keep us safe and to keep our patients safe. However, in this video, we talked about wearing masks and its effect on communication. So these are some important questions for us to ask. How important is a mask if when I'm wearing a mask, my patient, who may or may not have hearing loss, can't understand what I'm saying? What's more important, preventing the spread of COVID-19 or being able to communicate effectively with your doctor? Please respond in the comments of this video so we can have a healthy discussion about what's best for our community who has hearing loss and what's best for us when we're trying to communicate effectively with our doctors, of course, as well as preventing the spread of COVID-19 in our communities. If you like this video, make sure you give it a thumbs up and press that share button, because the more people we have talking about this subject and asking these questions is only going to help those who are having some difficulty understanding their doctor through a mask. Thanks guys, talk soon.